Hello there. We are here with Dr. Tiffany Groover. How are you doing?
I'm great. How are you?
I am doing well. I am really excited to have you talk with me today about your experiences in medicine. So let's just get started with where you're from.
I am from Boston, Massachusetts.
Oh, you're actually from Boston.
I
A
am born
real
and raised.
Bostonian.
Yes.
So I am curious, what motivated you to go into medicine?
For me, I would have to say I grew up in a environment where a lot of my family was very, very ill. And I think watching them and watching their interaction with the healthcare system was something that, one, I felt like I really, hands down, wanted to take care of people. I mean, I know it sounds very cliche, but that was something that I really, really wanted to do. And I wanted to make people feel better. The other was, I felt like things could be better if I was a part of the process. If I was the doctor in the doctor's office, if I was the nurse in the office, I felt like things would be better. I could do it differently than they did. And so I think that was my motivation. In addition to that, it was just a very intellectually stimulating environment for me. I felt as if medicine was very complicated but very intriguing.
Mm-hmm.
Just really, really drove my interest to pursue it. And I thought it was something that, I couldn't go wrong. I could be sort of secure in my profession and also have an effect on many lives. And I think that's why I chose to pursue medicine.
So let's talk a little bit about that. You said you will have an opportunity to impact many lives.
Mhm.
What does that mean?
What does that mean?
Yeah.
I think that, I, in medicine, I feel as if, or being, a physician, you definitely have that one-on-one interaction with that patient. But at the same time, that patient is a mother, a father, it's a family member, it's a member in the community, it's an employee. It expands beyond that interaction with that one person in the office. Someone's well-being and someone's health impacts, a community, impacts a nation. And so I feel as if, affecting one, if it's just one or a few hundred, could really have an impact on many. And so I honestly believe that. And I think medicine is probably one of few professions that allows you to do that, not only in that breadth, but also on such an intimate level.
Mm.
And so I think that's what I mean by that.
So what area of medicine are you practicing?
I am practicing adult medicine and primary care.
So what does that mean, adult medicine and primary care?
So adult medicine refers to taking care of patients that are anywhere from age 18 to 100 years old. And primary care is your person that you see in the clinic usually that takes care of you when you have like the run-of-the-mill colds or anything beyond that. And you see them on a regular basis, anywhere from yearly to sometimes monthly, depending on what your needs are.
So when you're seeing a patient and providing care, what are some of the challenges that you were there to meet for that patient?
Some of the challenges, number one is the illnesses that they're coping with at the time. So if someone has high blood pressure or
Which is common in African American communities.
very common, diabetes, which we refer to as high sugars, many of the diseases that are out there, you run the challenge of taking care of not only that illness, but all of the other things that come with that. So, you have, for example, a patient that has high blood pressure, but only has access to foods that have a lot of salt in it that can increase their blood pressure.
Yes.
So you're helping them figure out ways in which to have an alternative, whether it's, getting fresh vegetables or fresh fruits or whatever the alternative may be. Sometimes there may not be a grocery store close by that provides these foods. So you're helping them create avenues. So some of those social issues that play a role and also help, well, not help, but can lead to having an effect or an impact on their state of health is things that you also work to address.
So it seems like you're not only addressing the illness, and most commonly people think about doctors prescribing medications or things like that, but it seems like you're really looking into their lives and trying to enhance their lives.
Absolutely, absolutely. And I think that speaks to the beauty of medicine, which I feel, has fallen through the cracks sometimes, being that, we look at this world of medicine and as we have gone through the years, especially with young people who may be interested in this field, you realize that you're starting to see that medicine is becoming more structured, becoming more of a, somewhat people call it like a business.
Yes.
But there are moments, and there are times where it's not much of a business than it is an intricate opportunity to be in someone's life. And I think what we were just talking about speaks to the beauty of medicine.
So why is it important to have African American doctors in our communities?
So, great question. It's extremely important. African American physicians they're not many. And when there is one or few that are around, they have a great influence. Diversity in general is huge, right? So if you have someone who is African American or Hispanic in any environment, or Asian, or whatever the case may be, you enrich that environment. You have a number of different perspectives, different ways of thinking that provide sort of a richer cultural, enhancement to that environment. So I think African American physicians in particular are very few and far between. And so patients really they look for African American physicians. And, it's not just because necessarily that we look like each other. There is some evidence, there's some data, there's some research out there that actually talks about the influence that they call it sort of a cultural match or cultural competence that is there, that develops. It's called concordance, where having a physician and a patient of the same race has a more of a positive impact than it would if they were of two different races. It has a positive impact on health and the patient's perspective on health, their patient's perspective on their interaction with the physician. They feel as if they take more time. They feel as if they listen and address their issues. So it moves beyond just, they look just like me. There is an actual benefit that has been documented, that has been researched, that has shown that having a physician of the same race is a beautiful thing, and should be enhanced as much as possible, because our population is going to change dramatically within the next 10 to 12 years. And so we're going to have more African Americans in the general population than whites. We're going to have more Hispanics than whites. We need more African American physicians. We need more Hispanic physicians to help take care of these folks.
What is that like for you as an African American doctor to provide a care to another African American woman?
That's a good question. I mean, it's an amazing feeling. This is something that I've always wanted to do. Right? Because I saw my own family who looks just like me, who is African American, in these clinics, working with folks or having physicians take care of them that didn't necessarily look like them. And it's just a great feeling. I feel as if one, I am a reflection of them. Two, that I understand what they have been through, not necessarily being a mother, but being an African American, and what that sort of inherent struggle is like. Three, it's just the ability to be able to help them on another level. It's an amazing feeling. It's like I said, it's something that I've always wanted to do, and I feel very, very privileged to have this opportunity to do that.
What are some of those differences that an African American doctor is able to meet or address?
Mm-hmm. Um, you know, so there is some evidence to show that a lot of the African American physicians, whether it's the point of being a medical student to going into the next step of residency, that the makeup of an African American physician in training or physician, these individuals have are folks that come from these underserved communities. So these are a lot of people that, quite a few folks that have been products of a single parent household,
Yes.
that have been products of low socioeconomic status, so have been products of poorer families.
Yes.
Um, they have been products of families that have not sought higher education, who have not accomplished and achieved higher education. And I must say that I am a product of that as well. I'm not just saying this looking on the outside. I am one of those individuals.
Yes.
And I think that, having a patient that, not to say that all African American individuals are underserved or may not play on an equal playing field as far as socioeconomic status and education is concerned, but to be realistic, the majority do not. And so, I reflect those same experiences that my patients have. And there's something to be said. There's this sort of inherent, innate understanding of what they are coping with. And, being a little bit more empathetic about that. Not to say that other physicians of other races are not empathetic, but there's something to be said about me living that same life and someone else that's living the exact same life. You have a bond that is understood. And so you're able to, you work a little bit harder for them, a little bit smarter for them. And you try your best to provide what it is that they need, because you have been there. And to a certain extent, sometimes you're still there.
Right. During training, you're still there.
Very, very well. So I think that's what it is.
Some of the examples that I'm thinking about would be when you're talking to a minority person who doesn't have a lot of education, but you have to explain how they need to take care of themselves. Sometimes we use language, medical language, that's really hard for people to follow and understand. So I think as a minority doctor, you have an opportunity to explain things in terms that they understand, using examples that they understand that is meaningful to their lives.
Right. Absolutely. Absolutely. And there's something to be said about being able to relate and talk about, sugar. That's one thing that African Americans, that term they use quite commonly to define diabetes. And so using, like you said, using that terminology to explain things, having an understanding about what that southern cuisine is like, what that encompasses, and knowing, thinking of ways that we can work around, having fried this or pig feet that or whatever the case may be.
No, I remember pig's feet. I do. Pickled pig feet is what I remember.
Yes. So how do we, work to move around that? And also, being able, because I mean, being part of this population, that a lot of the influence comes out of the church communities.
Yeah.
And so using that as a way to get the foot in the door and helping to explain some of, the medical problems, the medical issues, having that as sort of a podium to help explain those things, or using that as leeway to get into these groups. I mean, having that familiarity is a wonderful thing.
Now, we know that medicine isn't easy for anybody. It's a very difficult field to first get into and then to survive in. What sort of advice would you have for young people who want to get into medicine? What would you tell them?
So I think you have to, um, in the very beginning, make a true commitment to yourself. And you have to be able to be realistic with what your goals are going to be and what you envision this to be. And know that there's going to be time, significant time of dedication. And I think when I made this decision, I put that all on the table in the very beginning. And yes, it is difficult because, not only is it just you, but you have your extended family, or there are financial issues, or there are, not so many cheerleaders in the background for you. And I think that you have to say to yourself, this is what I want to do, and no one is going to shake this. No one's going to shake this foundation. I found myself looking out for so many resources that I could find that were available. I mean, finances were an issue for me as well, but it's not to say that there aren't scholarships out there. Not to say that is not financial support out there. So there's some of this angst and anxiety I feel amongst many underrepresented minorities, that they're not going to succeed, that they're going to fulfill the stereotype that they're not, quote unquote, good enough. And I feel as if this is something I struggled with a lot in medical school, and as I was trying to get into medical school. And you really just have to have the cheerleaders. My mom did not achieve higher education whatsoever. She went to high school and that was it. But she was the greatest cheerleader in the background that I could ever imagine. She had no idea what medical school was about, no clue. She thinks I have a PhD. She had no clue. But she was the greatest cheerleader. And I think that what you have to do is identify those people that are going to support you through this process and will help you when it gets difficult, and will be that sound support system for you. And know that there are resources out there. There are folks like myself who are mentors, who are willing to sit down and talk with you about what you're going through and help you get through those tough times, or even just get there. And there are folks like that all around who are willing and able to be a part of this process, because we want you there. And so I had people that wanted me there. And so here I am, because I had that, and I had my own motivation and my own drive that no one was going to tell me I could not do this.
So, what are some of the challenges that you want to warn our young people about so that they can prepare for these sort of things?
Mm-hmm. The challenges of getting into medical school. I mean, first you have to start with, doing your undergraduate courses in college, those prerequisites, those pre-medical courses. I mean, the challenges are getting through those courses. That's the main challenge. And I think you cannot be shy about getting tutorial help, working in study groups, and really committing yourself. I mean, you can go out and have a good time, but you have to be very committed to this process. Applying to medical school, I mean, you have guidance counselors and program support directors that are in the undergraduate program that will help you get along in moving forward. There are a number of programs out there. There's one called Health Careers Opportunity Program, which
Oh,
is a program for underrepresented minorities who are interested in careers in health professions. And you can apply for this at your university. It may be available, or you can look it up online and apply. You have to meet a certain income line,
okay.
but some people meet it, and it's not an extreme poverty line.
Okay.
What they do is they provide tutorial resources for you. They support financially your training for the NCAT, which is the test to get into medical school. So they help you along this way for as many years as you need help to
Oh,
try and get into medical school. So that's one resource and one piece of advice. The other, as you go into medical school, are, of course, the rigor of medical school. You're going to be studying. You're going to be taking tests almost on a weekly basis. And it's a lot of work. Honestly, it's a lot of work. And it can get very difficult and challenging. But once again, you look out for your resources. Who can help me with this class? What tutors can I find? Tutors in medical school are free. They are free. Most medical schools provide free tutors. Your study groups, your colleagues are willing to help you as well. So it's not like you're by yourself when you get there. You have a great support system there as well. And then, you get in beyond medical school is residency, which I call on the job training, is how I explain it. That has its own challenges because you're in an environment where you're taking care of patients like you've never taken care of them before. And yes, you may be one of few underrepresented minorities, but you are one of few, and that is an amazing thing. You provide an amazing model of perseverance, an amazing model of opportunity to the many other medical students that are looking at you as they're trying to train and get to residency and finish this process. So I would say that it's a challenging journey, but it's a rewarding one at the end of the day, and it's a lot of sacrifice, but it is not impossible. It can be done, and it's an amazing opportunity.
and so it is, you're right, it's absolutely challenging. But I'm wondering, in your family, the
Mhm.
people who have seen you go through this challenge and be successful, how has that impacted them seeing you do what you do every single day?
Um, I think that I know that my mother, who has seen this whole process face on, she has seen the very challenging days and the very sad days that I've had throughout this process, and the very wonderful and the good days, which are more than the challenging, sad days. Um, but she is beyond proud. She has not kept her mouth shut at all. She is the lady that will let the world know that her daughter is a doctor, and she's very proud. And I think she, as my younger family members grow up, she is there to influence them, and she's telling them about this process, and letting it be known that, hey, someone has achieved this in our family. Let's not break this cycle. Let's keep going and achieve greater things. So, yeah, she is my number one fan, I must say. And I see my younger cousins and family members, starting to take on the ranks and doing things beyond, what was customary in our family. So it's great. It's great.
Also, I was wondering, outside of your family, how does your neighborhood respond to a doctor coming into their neighborhood every single day?
Mm. It's interesting because I consciously decided to stay in my neighborhood, the neighborhood I grew up in, to work in. for that reason, because it's such a reflection of my community for me to be where I am. They sort of molded me to this person to a certain extent, and they're very proud. I mean, it's for them. It's we want you to be here for us, and it's an honor to be able to give back to my community. As cliche as it sounds, it is a great honor to do that. And they appreciate that. And they're very excited about the possibilities ahead. And, they know at the end of the day, it's good old Tiffany has changed significantly, but they're just beyond proud.
Now, it's also important that minority doctors do things in their communities to help strengthen their communities. And I know that you are doing that.
Sure. So, for me, I had to, as I, started my on-the-job training for residency, I had to do something within my community that was more significant than not just, but, providing clinical care, providing care in the clinic. And I said, I find the same issue is that there are not a lot of underrepresented minorities in medicine and health careers. And so I wanted to be a resource, be a mentor to many of the young folks in the community that have an interest but may not have a role model to help, guide that interest. And so I'm actually working with the youth in the Boston area, and trying to really strengthen their interest in the health professions and be a physical role model that they can see and interact with, can ask questions, that they can learn about themselves and their own health and well-being, can learn about medicine in general. So I've been running that program. I developed and created that program and have been running it for the past 2 years. And it's not just myself. There are other doctors that I've collaborated with where my institution is, and we're working together. We have recently been able to establish ourselves within our institution. So not only is this a program that I kind of developed on the side, it's a program that will now be a part of the institution. So that leads to sustainability and promise to continue development of the program. So, I definitely have said to myself that we need to continue to work with young people, like the many who I hope are listening to this video, to get them interested and to let them know that we're here for them.
And so I was wondering, are there any sort of lesson learned or life lessons that you can kind of impart to these guys?
Yeah, absolutely. I think my number one life lesson is to believe in yourself at all moments. Never doubt yourself. Never doubt your abilities. Never think that you are not as good as the rest because of where you come from or who you are or how society defines you, or believes that you have a certain stereotype. Never believe in those things. Believe in yourself and who you are, and you will go far. I think that is something that I had to learn later on in my training. And once I learned that and took that and ran with it, things started to, just to climb to higher levels than I could ever imagine and think of. So I think believing in yourself is number one, and everything else will fall into place.
Absolutely. Well, I'm about to wrap up the video, but I wanted to see if there was anything else that was on your mind that you wanted to share with these guys before we come to a close.
I think, this video is an opportunity for you to learn a little bit more about the many folks that are out there in these various health professions. And not only is it an opportunity for you to learn about them, but it's also an opportunity for you to see that there are people that are like you in these environments that have experienced the many ways of your life, have had the same sort of setbacks and the same sort of limitations that you've had in your own life, and that we are a living example of what believing in your own dreams and the possibilities can do. And so I think really taking this video as an opportunity to grow into yourself and believing in yourself and tapping into your well-being and tapping into who you are as an individual and where you can go from here.
Are there any sort of tips that you want to share that these kids can maybe take to their parents, to their families, and share that they might not hear from their regular doctor?
A couple of tips I think would be to ask questions. When you go into and you see your doctor, do not be afraid to ask questions. Um, Come with questions. Come with, the things that you looked up and have questions about. Two, I would say be an advocate, and that is full of words and full of definition. But being an advocate is basically, that you feel something is wrong, that you need something beyond what someone is telling you that you need, and just being an advocate and making it known that this is your body, this is your health, and there's something else that you need from them. And I think just really knowing that your doctor, let alone should be there. I mean, they're obligated to be there and supporting you, but you should take advantage of that opportunity as much as you can. So I think those would be my tips.
Also, I was thinking that a lot of times we just don't go to the hospital. It seems like it's a place that we fear. We think that they're not going to treat us right. How does that help us when we have serious illnesses to have these thoughts and to behave in that way?
I think that it doesn't help at all. I think, but it's there's something to be said. I mean, it's sort of understood that people will have their speculations. They may think that this is not the place I was taken advantage of in the past, or other people were. But medicine and the health profession has taken a turn or we are starting to take more of a better turn, let's say, where we're making the patient a priority, and we're trying our best to do away with those speculations and do away with that feeling of or concern that there may be more harm than good going on. So I think my advice would be, to not wait till things are in such terrible conditions and situations, where your health is in such jeopardy that you may not even be able to recover. I think that one is taking advantage of a primary care physician in the clinics, in the whether it's a community health center or a private clinic, taking advantage of that opportunity and seeing those individuals on a regular basis will actually help prevent you from needing to go into the emergency room more often than you should. So, taking advantage of that and really being invested in your health and really being invested into making it to those doctor's appointments and to, the various appointments that you have to go to is really important. And I think, once you've developed a relationship with a doctor, you'll realize, that these speculations, are something that shouldn't drive you away from getting health care, that we're actually here to care for you and make your life a little bit better.
I was also thinking too that when a patient is sitting across from a doctor and a doctor is giving instructions, you don't always remember everything that the doctor is saying. What can they do so that they don't walk out that door and not know how to take care of themselves?
Um, so I think that what the patient can do is really say, okay, doc, let me make sure I have this right. Let's recap for a moment. And go through that same sort of recommendations or advice that was given step by step with the doctor. Bring in a pen and a piece of paper and write it down. Have the doctor. I am one of those physicians that likes to draw things out and write things out for patients. Not every physician's the same, but I think it's very helpful to have a visual there. So bring in your own piece of paper and a pen. Bring in another family member that can help you remember what was being said. And even, hey, say, hey, doc, do you mind writing this down for me so I won't forget? And I'm sure that they would be more than open to doing that for you.
Absolutely. Well, I'm not going to keep you because I can ask you tons and tons of questions all night long. So I promise I'm going to stop because everything that you have said, the wisdom that you have shared with us has really been very meaningful. And I'm so, so grateful to you for sharing your story and being open to this experience. So thank you so much.
Very welcome. You're very welcome.
All right. Goodbye.
Bye.